Hey guys, Dr. Dilip here, your internal medicine faculty at Cerebellum. Today, it's really a proud moment for all of us at Cerebellum because we got so much of toppers. But here with us right now is Dr. Ansh who scored an incredible rank of 54. I can really understand like what amount of hard work he has put in and how much he should have persisted in his preparation. And anyways, fine. So let us hear from his own words. Welcome, Dr. Ansh.
Hello, sir. Thank you.
Congratulations.
Thank you very much, sir.
It should be a proud moment for you. And how do you feel, first of all? And that's what,
Um, I couldn't believe it for like 1, 2 hours straight. Like I had to check it 5 times. That actually, I got such a good rank. I'm very happy, very elated. Actually,
no, obviously. I mean,
yes,
it's not only about you. I think your parents must be proud,
yes,
your siblings must be proud, your close friends must be happy for you, and we
yes,
are happy as well.
yes. Mm.
And who was the first person you called?
So actually, I just went to my mom and dad and I told them. Actually, my parents are doctors and they were both were in the operating room. So I had to enter the like outside the operating room. I just shouted, and after that, my mom came out. She was like, "I couldn't focus on the operation for 10 minutes because of you."
Yeah, that's an incredible feeling. Yeah. So when you get such a good rank and yeah, you have to tell to someone immediately because they have to vent it out. It's not only the sorrows that we want to vent it out, it's all the
Yes,
happiness also we want to vent it out to someone who is
yes,
really
sir.
close to us.
And
That's
sir, I have to say, like, I think I messaged on the group also. Sir, like, you have been a huge inspiration for me, even though you don't know me personally. But I feel so connected somehow. I consider you like a guru for myself. I've watched almost like I completed all the medicine from your app, and then I bought Cerebellum in the pre-booking just because you were there. I was like, sir is there, I have to get it, and really, sir, you have had a really big impact on me. And
Thank you so
like
much, Dr. Ansh. Thank you.
even in the exam, I could recall your words. Okay, like how you teach and how I have to approach. Even in the exam, even though I had watched your lectures 2 years ago, but still during the exam, I could recall your words.
Thank you
Like,
so much. And this time we did have a lot of medicine questions.
yes, sir. Actually, like people
Yeah.
say that you can skip medicine or whatever, but sir, medicine is very important, I think. And they were very conceptual questions which I could answer because of the concepts that you gave to me.
No, you
So,
can answer the facts using other subjects, but
yes,
unless until you start thinking like a physician, or unless
yes,
until you start making sense out of something, unless until you start reason things, it's very difficult to answer these kind of
yes,
questions.
actually,
That's what these three subjects bring into table, right? The medicine, surgery, and the OBGY. So
yes,
these subjects, what's going to bring into the table is the way you answer the questions in exam,
yes, sir.
the way they make you think logically, and like what do you do if the patient is presenting in front of you?
Yes, there were a lot of clinical questions and actually
Absolutely.
needed a understanding of the subject, like
Yeah,
to
that's why I say,
answer.
I mean, all the time. I mean, this is the same thing I told in the FMG interviews as well. Same thing I'll be telling in the future also. The medicine, surgery, OBGY,
Yes,
PSM. These four subjects are going to be the deciding factor, whether you get a good rank or not a very good rank. That's
uh,
it.
yes, sir.
Without these subjects, you can still crack up.
And like I think at least 40, 50 questions one could answer just from your own notes. Like out of 200, somehow I could recall, okay, Dilip sir has taught this. Uh,
Easily 50 to
yes,
60%.
yes,
Easily.
sir.
Anyway. Anyway, I mean, I need to ask you some questions.
Yes, sir.
So when you look back,
Yes, sir.
what do you think is the defining moment of your preparation?
So I think one thing which helped me the most was incorporating active recall into my preparation. Like I, so I've learned this from you that we should practice evidence-based medicine. And similarly, the only evidence-based study technique, one of the most best evidence-based study techniques is active recall. So that's why I really stuck to active recall.
Yeah, there are
And
two things, the Pomodoro and the active recall. These are the two things
yes,
which
so,
are
so
absolutely evidence-based. Yeah.
evidence-based. So I tell everyone that if you have to become a physician who practices evidence-based medicine, you should also practice evidence-based study techniques. And active recall is right up there. So
That impresses me a lot. I
yes,
mean, how much you, I mean, even though you said it in 2 words,
yes,
the way you said it, I mean, I want to do it, which is evidence-based,
yes, yes,
takes you one step higher, obviously. I mean, that tells you like you don't want to just blindly believe in something.
yes, sir. And I
just
learned
wanted
that
to,
from you, I
yeah,
think.
find out evidence for it and then you practice it.
Yes,
That's great.
yes,
So that you will define as a turning point in your career,
yes,
in
sir.
your PG career.
Yes, sir.
Okay. So everyone tends to get demotivated.
Yes, sir.
So what personal motivation helped you the most?
So
I can say what personal motivation kept you consistent throughout the journey.
I think my parents a lot, like I look up to them a lot. My parents are doctors and I absolutely look up to them. And uh, that really helped me, I think. And um, and sir, actually, I don't believe a lot in external motivation. Only internal motivation is what I feel is like the real thing. Like if someone thinks they can get external motivation by watching someone's words or anything, I don't think that works. The feeling has to be inside of you that we have to do good and like so.
Completely agree. Completely
Yes,
agree. The feeling must be internal. I mean, all this external motivation doesn't
it
last.
lasts. Yes, it doesn't last a lot.
Maybe for a few hours to few days, that's it.
Yes,
What
yes,
you feel internally, the fire that's burning inside you, is the
yes,
one that's going to propel you to long shots.
yes,
Okay. So next, what I'm going to ask is like, how did you manage your peak preparation days? And
yes,
there'll be few months, I believe, maybe that June to December. I
yes,
would
yes,
say in any aspirant's life will be that peak preparation months. So,
yes.
what strategy did you follow during the peak
Actually,
preparation months?
so
Everyone must have a unique strategy. Each and
yeah,
every
actually,
is different.
the last June to December, I was actually busy with my internship. I wouldn't say very hectic, but it was there and we had to go. So, like, it was going normal. I wouldn't say I could prepare in full throttle mode, but since January, like, we got a relaxation from the internship. So from then, I made sure that, like, whatever I have planned for the day, and I actively recall whatever I have read earlier and incorporating spaced repetition. Like, I have to revise and I have to actively recall. So I think that's what I stuck with, and being consistent. Like, it's not like I read something and then it's like, oh, okay, I'm done with it. 3 months later, if I feel I'll remember it, it doesn't work that way. I have to keep at it. Like if I completed a subject, then maybe 10 days later, 12 days later, I'll give a subject test of that subject, just to know what I have forgotten, what I don't need to revise, what I need to revise. So I think spaced repetition is also very important.
Yeah. So once you do the test, like probably you'll be knowing which place you are having lacunae, and probably you can fill it up with some gaps and add some points, and you can make the notes complete.
And like obviously, maybe people have a frequency of giving GTs. I didn't have that. I used to give it every 7 to 8 days, but it was more like when I felt I don't know whatever I'm studying, is it working or not? So when I felt that
Seven to
this,
eight days is a lot. You're giving GT once in 7 to 8 days is a lot
so
actually.
only the last four
Last.
5 months, 4 5 months, I'm saying that I used to give every week or every 10 days
So
to
still, you have
just
ended up giving like 15 to 20 GTs at least.
easily, sir. I think more than that, actually, 30,
So generally,
35.
that's what I would say. The sweet spot for
Mm.
GTs is around 20 at least.
Yes, sir. 20, I think I would say 28, 29 GTs.
Yeah.
A lot
So the
also
sweet spot
doesn't
is around
help.
anything about 20 GTs is
Yes,
fine. So
yes,
I
sir.
would say like if you're doing like less than 15, 10 GTs, it doesn't work.
Yes, sir.
So 20 to 40 GTs is what is like I would say like the
And
sweet.
actually, it's not like one just jumps into GTs. You have to make sure you have at least completed
Correct.
like the major subjects and few minor
Correct.
subjects, and then only one should get into
Correct.
GTs. Yes,
So
sir.
probably this is the strategy that you followed. You followed that spaced repetition, you are following the notes, and you're
Yes,
doing
sir.
the GTs like
Yes,
last 4 5 months.
yes, sir.
Yeah.
Actually,
So how did
and
you balance between the theory and the MCQs? In the sense, like people always say that I studied notes, notes, and notes and notes, but we always tend to disagree with that. So only
yes,
note
sir.
taking is
I
absolutely
think
not enough. You have to do a lot of MCQs.
so. Most importantly, I think recent like NEET and FMG both PYQs. I was very thorough. Like I practiced them
You
multiple
did
times.
FMG PYQs also.
Yes, yes, sir. And that actually helped me a lot. I think like there were many repeats
Wow,
from FMG PYQs. So I would
that will be
advise
very
everyone.
helpful for the future aspirants.
Yes, sir, I would advise everyone to be very, even if someone just practices recent like NEET and FMG PYQs thoroughly, they will be very good to go along with the theory. And apart from that, the grand test and per subject, at least 2 to 3 subject tests I gave. I think that is more than enough. And during my MBBS years, I solved the question bank, but I couldn't really touch on it during internship. So I think grand tests, PYQs, and subject tests would be my advice. Like because in Cerebellum also we continuously had that test and discussion, sir. Your tests, they were like very, uh, they gave us a thought process how to approach. And each, apart from CAN tests, I think subject tests are very helpful to get a grasp of every subject. Uh, so that was my
Coming to
main.
the MCQs, like we conduct a lot of GTs and ENDs in
Yes,
Cerebellum.
yes, sir.
So how are they useful? The GTs and the
Uh,
ENDs. I mean, especially what we have done in the last 4 or 5 months, we have
yes,
taken
sir.
a lot of notches higher. So we have
Mm-hmm, yes,
started giving the Q-based discussions in the video format for the
yes, sir.
GTs and all. I
Mm-hmm.
mean, how did you feel those are helpful?
Uh, I think the GTs were very close to the real exam. Like, actually, my score was almost similar to the real exam, what it was in the GTs. Like, it was uncanny how similar it was. It was almost very similar. So, I would say the GTs actually gave the feel of a real exam very much. Like, they weren't very tough or they weren't very easy. They were at the sweet spot. And like I said, ENDs, they would help me. Like every time I just can't, I have to revise a subject. I can't every time go and read the notes again and again and again. So if I have read the subject, then I give an END after some days. So I know what's weak. And then when I watch the discussion, I know, okay, like what I got wrong, this is how I should have approached. And it's a revision of the weak topics as well. It's not like very monotonous that I'm just revising my notes again and again and again. So I think like that, it was very helpful.
So the GTs, yeah, GT, I mean, yeah, we wanted to make the GTs look like the real exam. That's why we didn't make it too tough or we didn't make it
Uh,
too easy as well.
yes,
So
yes,
the message was clear. So the GTs has to be prepared by the faculties,
yes,
and we did all the heavy work and we did the GT questions. I mean,
yes.
it was a big task for all of us. We used to
Your
do at
your
the
hard
same.
work, it showed in
I
the
mean,
question.
not just mine. Every single
Yes,
faculty in curriculum
everyone,
have put in
everyone.
a lot of hard work in the GTs,
Yes,
and even the ENDs also. We wanted to make sure that the ENDs are like I mean, not very tough at the same time, not easy
mhm,
as well. So the
yes.
kind of moderate to moderately difficult category. So we wanted the students to think and answer. So not just
Yes.
blindly know a fact and just answer. They have to apply 2, 3 concepts at the same time in a single question. So
And like the discussion, it helps that how the teacher thinks uh, while approaching the question. So that helps a lot, I think. But even in that, sir, I think more than 2 to 3 per subject is too much. I think then you can't even revise all the things you
correct.
have done. So I'll say ki 2 to 3 subject tests
ENDs,
or ENDs,
subject
anything.
test ENDs is fine.
Yes, sir.
Okay. So MCQ practice is done. So what is the one habit that you think that gave you a personal edge for you? So one habit or maybe one technique, I would say. You said spaced repetition already,
Yes, sir.
that technique, but is there any habit or hobby that helped you? For
Mm,
I mean, I can put it in different perspective. So maybe you want to like what do you want to do when you're burnt out? Maybe you want to play, you want to do music, or you want to do something else.
I think, sir, when I used to try and stay active, like earlier when I was free, I used to take out time to go to the gym. But in the later months of my preparation, I actually had a pull-up bar in my room. Whenever I'm bored, I would just hit 2 to 3 pull-ups. So I would advise anyone to do that. It's actually very helpful and it refreshes the mind. So one thing that. Other than that, if I'm like I'm not in the mood to study, I'll just make a 10 questions custom modules of PYQs and then I'll solve that. And usually, if you're good, if you're able to solve, it's like okay, I'm whatever I'm reading, it's happening. I'm going on the right track. So it used to help and then give that
Oh,
motivation.
on a serious note, you have given
Yes,
a
sir.
lot of importance to your fitness as well.
Yes, sir. I think I kind of wanted that. So
Yeah. That's great to hear. Yeah, I mean, I can see what a kind of person you're just by the way you're answering certain things.
yes,
So
sir.
you wanted to be fit, you had a pull-up bar in your room and you wanted to go to gym, but you cannot go because of the
Yes, sir.
commitments and because what you have to read. And I completely understand. I mean, it's quite inspiring. And you have a very vast syllabus in NEET PG, you know that.
Yes, yes.
And people say a lot of things, but did you revise everything? Or did you choose some topics at
So
the
I
end of the
think
revise more?
like major subjects, stuck to main notes for the major subjects of gynae surgery, PSA. Other than that, for most minor subjects, I mostly went through rapid revision, like revision notes, because they are actually revisable. And then if you supplement it with PYQs and tests,
Mm.
it's more than enough. Like I don't think one needs to read. Like no offense to the respective faculties, but anesthesia, radiology, one cannot read the main notes of those subjects. I don't think there's any point in that. If you
So the
just
major subjects, you did the main notes,
note,
and
yes,
for
sir.
Short subjects, you did the QR and you revised only these things.
Yes, sir. Quick
Okay.
revision and PYQs. Quick revision
Okay,
also.
this is a common question that I'm going to ask to all the toppers.
Yes,
How
sir.
did you handle pressure on the exam day? I mean,
I
this
think
means that you should have handled pressure very well. I can
mm,
completely say you should have remained at, a lot calmer in exam. Like, what made you handle pressure very well? And if you want to point it on
I
something.
think one thing which I repeatedly told myself is I have read well, I have prepared well, I don't have to doubt myself. And like whatever answer which seems intuitively correct is the one that is correct. And if I have to convince myself ki I have to think a lot and then point out to some other answer, then that one is usually wrong. I just repeatedly kept telling myself, ki, okay, I have read well. I don't have to panic. Whatever is my intuition is correct. And I have heard a lot of people, they changed answers and they got it wrong. I'll tell everyone just from the night before, keep telling yourself, ki, my intuition is correct. My intuition is correct. I have to trust myself. So I think that helped me a lot actually. Whenever I used to feel like changing answer in the main exam, I was like, no, 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 what I'm thinking is correct. I don't have to doubt myself. So that helped me a lot, I think.
Did you face any self-doubt during your preparation?
Yes, sir. I think obviously everyone faces that, but initially, like I started preparing and my GT scores start improving. They improve slowly, slowly, but they improve. Even if they improve a little bit, it crushes that self doubt. Okay, that I have worked last 10 days, so my score has improved for a little bit. I'll work more; it will improve more.
And
So,
how do you
but
handle just by working more?
yes, sir. I think like uh, I don't have an exact answer to that. I think so. I don't
Okay,
think.
I understand
Mhm.
completely.
Yes, sir.
And I wanted you to tell if there is one mistake that you wish other NEET PG aspirants could avoid to get a rank like yours.
I think one a lot of people do
Consciously,
is
one has to avoid. What mistake do you feel? Maybe you could have sensed that with your colleagues. Maybe,
uh,
yes.
like maybe copying others or seeing what others are doing and chasing other resources. Like study this also, study that also, and going after very concise things and not trying to understand. I think all these things like stick to one thing which you have to ingrain into yourself. Don't go for extreme shortcuts, I would say. And understanding things definitely helps. And stick to one source, I would say. And please don't like focus on PYQs, especially FMG and NEET. Both PYQs is a very good thing that I can tell. Like, don't make the mistake of not doing FMG PYQs, I would say.
If you want to give just one final piece of golden advice,
I
like
think,
what?
sir, I'll stick to my one golden advice, which is active recall. Like, if anyone doesn't know about it, there are thousands of videos on the internet. There are lots of researches on PubMed itself about active recall. If you are an MBBS student, you have to know your way through PubMed and stuff. So go there, look up active recall, start believing in evidence, and practice it in your life. I think it will change everybody's life if they just start applying.
Now, Ranch, we had a discussion only for 10, 15 odd minutes, but I
Yes,
can
sir.
say that you're going to go to places.
Thank you, sir.
I'm
I
sure
hope
about it.
I
And I'm
have
sure
to.
about it. I generally don't tell this to all,
Yes, sir.
but the way you're speaking, you're very simple
Yes, sir.
and yet very powerful techniques. Very simple. You keep things very simple. You said
Yes,
everything in a very simple way, but these are very powerful messages.
thank you, sir.
And at such a young age, maybe you're just completed internship.
Yes, sir.
At such a young age, you're talking about evidence, seeking evidence, and you're trying to maintain yourself calm without putting much of a pressure. You know how much GTs to give, how much MCQs to answer, and you're saying that do not follow what others do
Yes,
all the time. So yes, we do follow what others do. It's fine, but
yes,
it's not a necessity that you have to follow like
yes, sir.
what you're doing every time.
Yes, sir. Like
So
not like three, four people you are following, and so that gets confusing. Have a set like okay, this person I have to follow, or I don't think we need to follow anyone. You just discover things on your
yeah,
own.
this is what I keep telling in the interviews, and this is what I keep telling to students as well. You have to be, like what Bruce Lee has said. Like just take whatever is good and remove whatever you feel is not good and add something to fill up that what you have removed from your own so that it becomes your own.
Like I think any preparation is a journey, and you have to discover it yourself. You can't be like someone will guide me and I can just follow blindly what that person did. Everyone makes mistakes, they learn, and I think 1 year is also a good enough time to learn from your own mistakes continuously and improve on it and then do well.
No,
Uh,
no, I can understand. Definitely, I can understand why you scored this good rank. Number one, easily. And number two, like as I said already, like you're going to go to places. There is absolutely no doubt about that. So, what's your favorite field, by the way? So, what do you wish to take?
so most probably, I'm actually slightly confused, but most probably orthopedics, I think, or most probably orthopedics.
Most
Actually,
probably, I mean, obviously, you're going to get everything, whatever you
yes,
wish.
yes, sir.
So there's no doubt about that. So, you wanted to become an orthopedician.
Yes, my father is also
Like,
an
I'm
orthopedist.
happy that I don't have a competition in the form of you in internal medicine. Like you seem like a guy who's going to give a tough competition to so many people. I mean, I'm sure about it. I mean, whatever field you go at, you're going to excel. But anyways, wishing you all the very best for your future journey. You're 100% going to get orthopedics in whichever institute you wish to.
Thank you, sir.
And I mean, that's it anyway. So like, it's time. I mean, I want to ask some rapid fire questions. Are you ready?
Yes, sir. Okay.
Okay. So one subject that you loved revising the most.
Medicine, actually. Not
I
no
mean,
bias,
that's
but
quite an
actually,
interesting answer. You know, like when I interviewed some FMG candidates recently, even
yes.
they said medicine. I got very surprised. And I mean, 2 years ago, if you talk to students, like they say, like medicine is the one I hate the most.
No, sir. I think you made it lovable for everyone.
Thank you. I mean, that's a lot of kind words on me. I mean, thank you so much for that.
Yes.
So you said like medicine is the subject that you love the most, and which subject you didn't like the most to revise?
Anatomy, actually.
Same here, same here. I mean, you have a person for company which is sitting, I mean, who's sitting in front of you. And I'm someone who doesn't like revising anatomy because I don't know, like it's a lot of facts, too much of
Yes,
facts.
yes.
Remember every time. And I mean, no, the one thing about the short subjects, even though we tell they are simple and easy, as long as the questions are predictable and come from the facts that we learned, it becomes easy. Even if they ask one fact that is not there in the notes or something different, it becomes tough.
Then you can't predict it at
Yeah,
all.
but that's the beauty of the clinical sciences like medicine or surgery. Like
Yes,
if you know the concept, at least you can give an educational guess,
yes, sir,
educated guess.
actually.
So that's fine.
Like
So
the course is so wide, no one can read everything. But if you are thorough with the concepts, you can actually make your education
correct.
yes. Okay.
Absolutely, yes. And which subject gave you a lot of sleepless nights? In the sense like you're so scared about that subject.
And yes, definitely community medicine. Definitely. Like I hated it so much, but thankfully I mastered it somehow, like after a lot of persistence. But okay, yes, definitely, because it has so much weightage, and then I have to remember how deep a trench is dug, how deep a well is dug, and all that. So it's definitely it gave me nightmares.
So MCQs, when you're supposed to do? So in the morning or you're going to do the late night PYQ marathons?
So mostly late night, I think. When
That's the
I'm
reason we start with the late night.
yes, sir.
PYQ
Actually,
marathons. Actually, I mean, this is the true thing. The reason is because we did discuss with a lot of students. We
yes.
ask them again, we talk about that evidence based, right?
Uh,
Talk to some students, I mean, in fact, many students, and majority of them said they are going to give the PYQs late in the evening or late in the night. And in that, like majority of the students, like 60% plus suggested to make that in the late of the night, like 11 p.m. or 12 a.m. So that's actually the reason for why you get that late night PYQ marathons in Cerebellum. So
yes.
it's again technically evidence based. Like
True.
that's what I want to hear from you. Before telling
Yes.
that, I want to hear
Uh,
from you. So when do you prefer? I mean, you prefer late night, obviously. So what's your favorite drink? I mean, you think it's, I mean, it's only tea, coffee, and nothing else you can tell.
so black coffee, obviously, I think
Man, you're such a
definitely.
fitness freak, by the way. So you wanted black coffee, or I mean, it's in view of fitness, you're using black coffee, or you like black coffee, by the way.
Uh, I like black coffee actually, I think, and like, but I would limit it to 2 p.m. in the day, not after that. After that, if I needed a drink, I'll go for green tea, actually, because then it messes up with your circadian rhythm.
Okay. So what one feature in Cerebellum app you like the most? You'll place it on number one.
I think the GTs were the best. I think how close they were to the real exam, I would say. Uh,
Okay. You put the credit on the GTs number one.
yes, sir. I,
Okay. maybe you can say teachers. Who are the favorite teachers at Cerebellum?
So you definitely like.
Thank you so much. I mean, I'm sitting in front of you, so you have to mention me.
No, sir. Actually, like I'm not even kidding. I mentioned to my friend that I have to give interview to Dr. Dilip. He's like, your childhood dream is completed. It's like, actually, I used to
No, no, we'll
tell
meet
my
someday. I mean, hopefully, like
yes,
I'm happy to meet you because you're not my competition anymore. You wanted orthopedics, so it's fine. We'll meet
yes,
someday.
sir.
So
I
maybe
really
once you
want
come
to.
to Chennai or probably if I visit your place, yes,
Okay, sir.
we'll have a dinner someday for sure.
Definitely, sir.
So I
Definitely.
mean, apart from me,
Mm, so I think Diana ma'am from OBG. I think.
Prana ma'am,
Yes.
I'll definitely convey this to her.
Mm.
Cute teacher, very good teacher. Yeah.
Yes. Yes.
Okay. So you told about two people. Okay. So what do you, I mean, go to stress buster during your preparation? You said like you wanted to like do the like
Yes,
pull up.
sir. And apart from that, I used to watch some TV series which I had already watched, so that I don't binge watch. If I'm very bored, I'll just rewatch an episode of something I've watched, and that used to help me.
Yeah, I mean, you mostly reflect myself because I do the same. I don't watch new series because if you start watching a new series during a busy schedule, you end up
Yes,
watching it and you waste a lot of time.
yes, sir.
So what I generally do is, for example, I like a movie called Edge of Tomorrow, if you remember. So
Okay,
it's a Tom Cruise movie. I like that movie very much. And there
okay.
is another movie in Tamil called Tani Oruvan. I don't know. There are certain scenes in those movies which I like the most.
Yes,
So
sir.
whenever I feel bored or whenever I feel like I want to do something else, I watch the scenes of those movies.
Yes, sir.
So we know
I used.
exactly where those scenes are going to be, and we only those 2-3 minutes, and we finish it.
Yes, sir.
So
I
that's
used to
the
do
best
that with the
solution.
series. With the series I like, so I used to rewatch certain
Perfect, perfect.
episodes.
Perfectly understand. I can
Yes,
completely understand, and I'm aligned
yes,
with you because like I do the same. I don't watch a new series because I end up binge watching at the end of the day, which I don't want it. So I know whichever things I watched in the past, I'm going to rewatch those important scenes or
yes.
whichever the scenes I like the most. Okay. So if you can go back in time, maybe if you want to change one thing so that will propel you to NEET PG rank one. I mean,
So
if
I
it's good
think
rank, I agree. I mean, it's much of a tough question. If you
no, sir,
want to
I think
change one thing, I mean, everyone, because every single candidate will have some regret. I mean, this is the same for like, even for rank one, if you ask, I mean, it might look like as if they're arrogant, but it's not. Even for rank one, every single candidate has some piece of some small thing they would have been corrected to get even more marks.
I think, like I said, I didn't like anatomy at all, so I didn't focus on it. And then I got two easy questions of anatomy wrong in the main exam. So if I could go back and actually read anatomy properly, I could
So
have.
this again puts up a message that even if you hate the subject,
Yes, you have to
you
put
have to
through.
master it. You have to
Yes,
study the concepts. Otherwise, you
yes,
end up making silly mistakes like this, and your rank will be like not what you really expected.
yes, correct.
Okay,
Like even
fantastic,
if
fantastic.
you hate a subject, still.
Yeah, fantastic, Dr. Ansh. And it's
Thank
been a
you.
pleasure interviewing you.
Thank you, sir.
And we're going to meet someday for sure. No worries about that. And thank you very, very, very much.
Thank you, sir.
Okay, see you soon.
Okay.
Bye bye.
Okay.
All the very best.